Go back to the presentation, and you see that here we have the slide that shows that we are going to listen to your presentations that present the leaflets that give information to a patient about these procedures and tests. So, and let us just start with this just procedure, which is given here, the first colostomy. Well, and who was just responsible for this procedure?
I and Rafi were responsible.
The names, please.
Umme Ayman, Sheikh Umme Ayman, and Mohammed Abdul Rafi.
I see. So, well, we need to. So, do you have the presentation on your computer? Ayman.
Rafi, yes, do you have?
So,
yes, ma'am.
And I need to to give you the right to share the screen.
Yes, ma'am.
You can do this. Yes, I've just switched on this option. So, will you start with the presentation, please, now?
Yes, ma'am.
And the rest of the students should listen to the presentation and please be ready to ask some questions on what the speakers are talking about. Yes?
Ma'am, still it is not enabled, ma'am. It is saying host disabled participant screen sharing.
Yes, ma'am.
Yes, I see. Now, try
Yes,
it now.
Is it visible, ma'am?
Not yet. Yes, now.
Yes, it is.
Yes.
So, ma'am, I'll start. Ma'am, we have made the leaflet presentation about colostomy. So, ma'am, basically, it is presented by me, Sheikh Umme Ayman, and Mohammed Abdul Rafi, ma'am. Rafi, can you move to second slide? So, ma'am, what preparation do I need to do, or do patient need to do? So, ma'am, first is don't eat for 12 hours before the test, ma'am. The stomach needs to be empty because, and ma'am, you may be given laxative or anemia to take the night before the surgery so that it can help to cleanse your bowels or large intestine, ma'am. So, patient should not eat before 12 hours of the procedure. And ma'am, the next is patient should be prepared to stay in hospital for like 3 to 7 days a week or two. So ma'am, it will include their packing their necessities to the hospital, like arranging care for their children or pets, or arranging care of their home, ma'am, and taking appropriate time or sufficient amount of time off the work, ma'am, off to work. And ma'am, patient should tell if patient is taking any medications. They should tell the parent, the doctors, that they may be stopped before the test, ma'am. And ma'am, they must have somebody to accompany them for maybe for the moral support, or like sedatives are given or laxatives are given. There are some side effects for laxative also. And ma'am, the next is what can I expect after colostomy? So, ma'am, basically the colostomy is a surgical operation in which colon is cut shortened to remove the damaged part. And ma'am, the cut end of the colon is directed out through the abdominal wall, ma'am, and create an stoma where a pouch of collecting feces is attached, ma'am. And ma'am, what can I expect after colostomy, ma'am? Most of the people stay in the hospital up to 1 week after this procedure. And ma'am, the recovery from colostomy can take up to 2 months. And ma'am, during this time, patient will have the limit on what they can eat, or while colon is healing, ma'am. So, ma'am, what they can eat is low fat foods, low fiber foods, and ma'am, even lactose free dairy products should be taken, ma'am, because ma'am, high fiber foods should be avoided, because ma'am, stomach this sometimes that high fiber fruits stimulate the gut, which can give the diarrhea or may cause the blockage, ma'am, blockage of stoma. And ma'am, after colostomy, patient can expect to feel better and stronger each day, but patient may get tired and tired quickly at first, ma'am. That patient's belly may be sore, and probably they need medicines for pain for a week or two, ma'am. And some side effects may be, or like some symptoms may be like swollen of stoma, ma'am. And after colostomy, ma'am, it is better to avoid the high fiber foods, as I already mentioned the reason, and carbonated drinks, ma'am, high fat or fried foods, ma'am. And even a patient should avoid raw fruits with skin and raw vegetables, ma'am, because they have some kind of sclerenchymatous tissue, ma'am, which does not dissolve in human body, which does not which cannot be digested by human body. So it should be avoided, because it can cause stoma to be swollen or blockage, ma'am. So, ma'am, from here Rafi will continue.
Okay.
Yes, ma'am. Are there any side effects or complications from colostomy? Most of the colostomies are performed without any problem, but since colostomy is a major surgery, it carries a few risks such as allergic reactions to anesthesia, ma'am, internal bleeding, problems from the scar tissue, or a wound break open. But these complications barely occurs. A small number of patients might have excessive bleeding, which may cause infections, damage the nearby organ spread. People also complain of having rectal discharges every few weeks, but these are easily manageable. If we talk about serious complications, in rare cases, people develop serious complications such as parastomal herniation, blotting and swelling in the tummy, stomal prolapse, and stenosis. A parastomal hernia is where the intestine pushed through the muscle around the stoma, ma'am. It result in the bulge under the skin, ma'am. But this is easily avoidable, like by wearing a support garment or a belt, and by avoiding heavy lifting or straining, and by maintaining a healthy weight. And a prolapse of the stoma occurs when the bowel protrudes through the stomal opening in the skin, as shown in the picture. Although this might feel distressing and frightening, it is usually not serious and can be treated easily. And some people develop blockage in their stoma as a result of buildup of the food, which causes blotting and swelling of the tummy. And they might also feel difficulty in passing the feces. In this condition, one should contact the GP or the stoma nurse immediately. That's all, ma'am. Thank you.
Okay. Okay, so and you have the list of sources that you used in just preparing this presentation. Okay, do any students have any questions about this procedure to the speakers?
No, ma'am, they have explained very well.
Do you have any recommendations to the speakers? No. Okay, it was very interesting and informative, and I would recommend, so you used the full sentences on the slides. I would recommend to use just only key phrases, just to put the bullets and key phrases, not the full sentences, and then it will be just more interesting to just to listen to you, because there is no need to listen to you, but because you've given all the information on the slides. So you just make some just surprise for the listeners, just the key phrase, and they will expect what you are going to say about this key phrase. You see? Well, good.
Yes.
Thank you. So the next piece of information is about
ERCP.
just it's about who? Yes, ERCP, which is very complicated to pronounce. And who is going to speak about this?
Ma'am, Samita and Prakriti. Rafi, can you please share the screen? I am not joining through laptop today.
Prakriti and who?
Yes,
Samita.
wait a second. I'm downloading it.
Mhm.
Samita.
Okay, Samhita and Prakriti. So can you share the screen?
Ma'am, actually, I have sent my PPT to Rafi. He can share it because he is the one who have joined to laptop. Joined from laptop.
Okay.
Yes, ma'am. Wait a second, ma'am. It's downloading.
Mhm.
Is it visible?
Yes.
Yes,
it is.
yes.
Mhm.
Yes, it is.
So Rafi, can you move to the second slide? Ma'am, when we talk about ERCP, that is, its full form is endoscopic retrograde cholangiopancreatography. ERCP. So, ma'am, for the preparation, the person should not eat anything before 6 hours of ERCP. The person should not drink 4 hours to the appointment of ERCP. And, ma'am, if any person is taking any medication, he or she should inform that to the general practitioner or the doctor or anyone in the hospital so that their medications can be altered. Rafi, can you move to the third slide? Ma'am, the side effects of ERCP, ma'am, basically ERCP is usually 90% of the cases don't have any side effect or complication, but there is a small chance of bleeding, infection, perforation, sore throat, and lump in the pancreas. And what, ma'am, rest from here, Prakriti can continue.
Mhm.
The last.
Yes, ma'am. Ma'am,
Prakriti, you're mute.
can I expect the after ERCPR? Ma'am, due to the sedation, make sure you have the someone with you, and ma'am, do not drink any alcohol, and ma'am, do not drive vehicle and operate any machinery, and ma'am, yeah, return to the week for a 24-hour. Rafi can change the next slide. And ma'am, is ERCPR is reliable? Ma'am, ERCPR is safe procedure and serious complications are uncommon. So that, ma'am, there are alternative method for the PCT, MRI, X-ray, but no possible treatment can be preferred. So, ma'am, ERCPR is more reliable than these X-ray and MRI.
Okay, is that all?
Yes,
Yes.
ma'am.
Okay, thank you. Any questions to the speakers? No questions. So, well, it looks like I don't understand what about this procedure. I mean, that I would recommend to use some illustrations to just to make it more easy to understand to the patients. So
Okay, ma'am.
why didn't you use illustrations? Because it's not very clear from the presentation what this procedure is about. But so the recommendations are very good. So thank you. Well, so the next, the next procedure we're going to speak about is bronchoscopy, right?
Yes, ma'am.
And who is going to speak about this?
Yes, ma'am. Prerna Muga, ma'am. Nishad, have been doing it.
Verna and Nishad.
Yes, ma'am.
Yes, ma'am. So, ma'am, I'm
sharing my screen 1 second.
Mhm.
Is my screen visible?
Yes.
Yes. Okay. So, ma'am, myself, Prerna Mugam, and my teammate is Nishad. So, we have prepared a task about bronchoscopy. So, let me first introduce you all about what is it. So, ma'am, bronchoscopy is a medical test in which we can test what is the issue with our lungs, and it is usually done to diagnose any lung problem. So, what a bronchoscope has? A bronchoscope has, ma'am, a camera, and it has a we can say it has some thin tube, so it can go into the lungs, and it can if needed, it can take a mucus also for further testing. So this is the method of bronchoscopy. So my teammate Nishat will explain about the procedure one should convey to the patient. So Nishat.
Yes. Like first of all, firstly we should introduce ourselves to the patient and clarify the patient's identity. Like, hi, good morning. I'm your attending doctor for bronchoscopy, and I would be happy if you fully cooperate with me. After that, secondly, we should like explain the procedure to the patient and like gaining the consent to continue the procedure, and like explaining the procedure to the patient, like I will be doing this test to find out the cause of the problem. Are you okay with it?
So, ma'am, here Nishat will be playing the doctor, role of doctor, and I will be the patient.
Okay.
So, Nishat can ask the question again.
Yes, I will be doing this test to find out the cause of the lung problem. Are you all right with it?
Yeah, I'm perfectly all right, doctor.
Yes.
What are you
Firstly, what?
doing?
Yeah, sure. You can ask.
What are you going to
Firstly,
do, doctor?
yes. Firstly, what we are doing in this test are like, firstly, you may be asked to remove your clothes, or if so, you will be given a hospital gown to wear, and you may be asked to remove all the jewelries which you are wearing, and then you will sit on the procedure table with the head raised like a chair. After that, what we are going to do is to connect you to the sensors to track your blood pressures, heart rate, and the oxygen level by the nurse to keep the vitals monitored. Then the IV and oxygen will be monitored. Are you okay with it?
Yeah, doctor. Perfectly all right.
Then you will be unconsciously sedated and will receive a local anesthesia, like to feel like you will not feel any pain during the process.
Okay.
Once you will be comforted, I will insert the bronchoscope into your mouth or nose, like down through your vocal cords, into your lungs, and you may cough, and like it may be uncomfortable, like as the bronchoscope goes in, like, but it shouldn't be hurt. After that, the camera will show us the interior part of the respiratory system. Then we will take the sample of tissue to for bioscopy, biopsy, and we will clear the airways. You don't have to worry about the procedure. It will be smoothly done.
Yeah, I'm looking forward for it.
Yes. What you have to follow, like before the procedures, before the bronchoscopy, you have to do like some you have to follow, like you don't have to drink or eat anything after midnight on the night before your bronchoscopy procedure. And after the procedure, you wouldn't be able to drive because of anesthesia. You wouldn't able, like you should have someone to accompany you to take you home.
Okay, doctor. So, can you please tell me about the risks and side effects that I
Yeah,
might have?
sure. Like bronchoscopy is usually safe, but there are like few risks if your oxygen level drops during the procedure. and then we will give you some oxygen, and you may you may have fever for more than a day, like chest pain and trouble breathing. You have to take your medications properly on time, like to avoid their risk and side effects. Like you don't have to worry. You have to worry. It will be better with time.
Okay, I now I understand the procedure, doctor. Thank you.
Yeah. Thank you for your cooperation.
So, ma'am, as you can see that in this picture, it is completely viewed that how the bronchoscopy takes place. As Nishat explained that the patient will be lie down on the bed or stretcher, and the insertion of tube, and it will be viewed in a screen. So these are the ma'am procedures that follows. And here we have a picture of our bronchoscope, which has a camera which fits onto this end, and a soft rubber which is passed through the nose, and this end goes into, so this is the end, so that for the light source. So these are the references, ma'am, and
Okay.
that's all. Thank you.
Okay.
Thank you.
Thank you
ma'am.
so much. Does anyone have any questions?
No, ma'am.
No questions. So I like your presentation very much. So especially your role playing, and so you've used simple non-technical terms just to make it easy to understand to a patient. And so, and it's very good that you give examples of just phrases used by the doctor while explaining the procedure to a patient, not just instructions, but also this conversation between the doctor and patient. Thank you so much. Okay. And if we go on, so here, what do we have next? This is heniography, so how, I don't know how to pronounce this word. And so who was responsible? Okay.
Hemotherapy, ma'am.
Ma'am, it should
And
actually it
oh,
should be
sorry,
explained by Rajkumar and Badrish, ma'am, but
Harina,
both of
yes,
them
yes.
are absent, ma'am, unfortunately.
So no one has done this? Who was responsible for this procedure?
Ma'am, Badris and Rajkumar were responsible, but both are absent today.
Rajkumar. So I see. Just a minute. So the next procedure is blood test, right? Who's going to speak about this?
Ma'am, myself, Priya, and Divyashri will gonna speak about blood
Priya?
test.
Okay.
Yes, ma'am.
Yes.
Arunachal, can you share the screen?
Start, please.
Yes, ma'am. Ma'am, first of all, what is the
Is it okay now? Is it visible?
it's okay.
Yes.
Ma'am, first of all, what is blood test? Ma'am, blood test, if blood test is the blood test is used to diagnose. In order to test our blood, a technician called phlebotomist is used to need to take a sample. And then what does doctor do for the blood test? When a doctor orders a blood test, it will usually collect it from the vein, and it used to test any diagnosed or discover abnormalities in the sample of our blood, and it used to evaluate organs, diagnose diseases, and find risk factors. Blood clotting, test the blood clotting effectiveness of drug. And the procedure, ma'am, I only mentioned about the doctor conversation of doctor only. So the procedure of blood test is hello, how can I help? Hello, how are you? And then the patient will reply that yes, I am fine. And and then and then certainly please have a seat and roll up your sleeves. And what and the patient will reply for that is what is the test for. We're gonna explain about the blood test, and well, today I am going to check your white blood cells or blood test count, and it will, and we have to tell them about what does it means, and then it is we have to explain that procedure. If we have, well, if it is evaluated, you might have an infection, and he will ask that will the blood test hurt. Then the patient, then we have to reply that it is only a little pin stick. I am going to put a tourniquet on your arm to puff your pains, and and that's all the procedure, ma'am. And after about complications, Divishri will explain.
Mhm.
Yes, ma'am. Ma'am, it includes it's a very rare for a blood test to result in serious complications, ma'am. However, there is a very small possibility of complications arising. It may include infection, excessive bleeding, ma'am, and bruising, and fainting and dizziness, ma'am, and hematoma, ma'am. And the main risk of blood test or discomfort and bruising at the site where the needle goes in, ma'am. These complications usually are minor and go away shortly after the test are done, ma'am. That's all about it, ma'am.
Mhm. Mhm. Okay, okay. Thank you. Does anyone have any questions?
No, ma'am.
No questions. Yes, something funny? Okay. Well, the next, so thank you for this presentation. And the next speaker is, we'll be speaking about chemotherapy, right? So,
And it is me and Arunachalam, ma'am.
will you repeat who is responsible for this?
Madhumita and Arunachalam, ma'am.
So can we start the presentation?
Yes, ma'am. Arunachalam will share the screen.
Okay.
Is it visible?
Yes, we can see.
Yes, ma'am.
Arunachalam, zoom in the first slide.
Mhm.
Ma'am, we have just elaborated the complication in other slides, ma'am. So what should a patient be prepared for? I will tell it orally itself, ma'am. Ma'am, first of all, chemotherapy is an therapy which is used to cure cancer, ma'am. It is usually used to treat cancer, as cancer cells grow very faster and rapidly in our body, ma'am. It can also be accompanied with therapies such as surgery, radiation, and hormone therapy, ma'am. And what should a patient be prepared for is, first the patient should learn about the treatment, ma'am. Like what are the goals of the treatment, and how can a chemotherapy cure the cancer, and where will the treatment be undergone, ma'am. And other things like what will be the name of the drugs that he'll be taking, and will there be any emergencies after the chemotherapy, and the patient should know about the fertility. If the patient is female, she should know about the fertility procedures, ma'am. Before the chemotherapy or after the chemotherapy, the patient should not try for the babies, ma'am. And when we come to the complications, the first complication can be the infection and weakened immune system, ma'am. Most of the people, that is very rare. Infection is very rare, ma'am.
because chemotherapy kills the immune cells, it can make the person very vulnerable, more prone to the infections, ma'am. And because the immune system is weakened, any infection may last longer than usual, ma'am. To cure this, he can eat plenty of fresh fruits and vegetables. Frequently, you should wash his hands. It is basically, it should be hygiene, ma'am. And the second complication may be bruising and bleeding, ma'am. It is very often in the chemotherapy patients, ma'am. If he gets cut easily, or there will not be blood clotting, ma'am. It will be very difficult for him to clot the blood, ma'am. And Arunachalam will continue with other complications.
Yes, ma'am. Further, to start chemotherapy, it is actually drug therapy to decrease the size of the tumor and relieve the sign and symptoms of the particular case, ma'am. And the main aim is to cure the cancer, to make the patient feel comfortable and to control the disease, ma'am. And then coming to the health, who can organize this chemotherapies? Oncologist and oncologist supportive nurse can organize, ma'am, and also radiologist, surgeon, and also the one who's providing the drugs, the dosologist. They're all involved in this process of chemotherapy, ma'am. And also there are many types of chemotherapy, ma'am. Neoadjuvant, adjuvant, single dose chemotherapy, and combination chemotherapy based on the depth or impact of the patient's status, ma'am. And also chemotherapy, the first and foremost complications is we can see the hair loss, ma'am, and nausea and vomiting. Hair loss is very common in the cancer patients, ma'am. And also there are also many possible side effects of this chemotherapy treatment, ma'am. Vomiting, loss of appetite, fever, also constipation and bleeding, ma'am. And neurotherapy, ma'am, it is a pain caused in the nerves, ma'am, and hands, on the numbness, and also, as I said, constipation and diarrhea, ma'am. And after this chemotherapy is in most cases based on the impact, it is mostly successful only, ma'am. The patient feels comfortable, and he can lead a normal life after the process of chemotherapy, ma'am. Yes, ma'am.
Is it all?
Yes, ma'am. That's all, ma'am. And this chemotherapy also can be given in form of pills, or creams can be applied, also drugs. Also they can directly, the radiation can be given directly to the cancer, part of cancer in the body, ma'am. It can be diagnosed by WBC, the red blood test count, and blood test is a major diagnosis for this disease, ma'am.
Okay, thank you. So you've also shown that some more complications of these procedures, very serious procedure. Okay, but it's very good that you've told us about chemotherapy, but the task here was just to speak about chemotherapy. So you've chosen another topic to discuss, right? Okay.
Chemotherapy is actually chemotherapy is actually it is actually to the treatment of a certain blood transfusion, ma'am.
Okay, yes. So I mean that this is another kind of procedure, right?
So, and in those chemotherapy, it is not much depth, ma'am. It is only given as a treatment of blood treatment, ma'am. So the chemotherapy is more similar to chemotherapy, ma'am. So we did this, ma'am.
Really? So I thought they are completely different. So
no, ma'am, they're not different.
Different. I see. Okay. Well, anyway, thank you for your very interesting presentations. So I've learned a lot from them. And I thought that they were useful because you focused on some procedures, common procedures which you will meet in your real medical practice. And we have some time just to speak about the home assignment. I mean that, so the home assignment will be given on the model site, and so unfortunately we didn't have time today to speak about grammar structures, phrasal verbs, which were used by the doctor in his conversation about taking aspirin. But anyway, I think that you are familiar with these structures like phrasal verbs, and so the home task will be some practical exercises on the use of phrasal verbs. You'll find them on the Moodle site. So, and so the deadline, as we usually have, this is Saturday night. And so I'll expect you to upload your answers so by Saturday. And so do you have any questions?